All right, nurse, why don't you share a little bit about your professional background? I know nothing about you, so tell me, basically starting from...
Call time out real quick. You left out 11, and if you subsequently think of that and want me to produce somebody else, she's here to do that.
No, that's fine. I'm sorry. I didn't mean to.
Okay.
If you go to page 11.
No, number 11.
Number 11 on page 3, I'm sorry. You prepared to talk about that too?
I am.
Okay, thanks. Got past me. Okay. Tell us a little bit about your educational background.
I'm a pediatric nurse. I have been a nurse since 2001. I have a master's degree in clinical education, and I'm currently the director of clinical education at the Children's Hospital.
All right. What are the main duties and responsibilities in your role as the director of education?
I oversee onboarding, orientation, and continuing education of nurses and clinical staff at the Children's Hospital.
And we'll talk about these specifically, about the means of doing that, but are you the person highest on the totem pole responsible for making sure education's done properly?
Yes, sir, in the Children's Hospital.
All right. And how long have you had that job?
Since July of 2015.
All right. Well, let's go ahead and dive into this thing. And let's start with number 4 on page 2. And I have these exhibits here that were supplied to me by Vanderbilt, so if we can refer to these, if there are documents that are responsive to this, just tell me, we'll go through these documents. Number 4 is the representative shall testify regarding all policies, practices, and procedures of how nurses are trained and expected to apply and maintain sequential compression device on the patient. I guess we're starting with the question on the table is, what policies are there?
We do not have policies specifically regarding SCDs.
Okay. Has this hospital ever had policies specifically regarding SCDs?
Not to my knowledge while I've been in this role.
Okay. Do you know if there are any policies in the adult hospital pertaining to SCDs?
I do not.
Okay. How are the nurses trained and expected to apply and maintain sequential compression devices?
Nurses receive training and orientation by their preceptor.
All right. And how are they trained?
They provide the preceptors provide a skills validation checkoff while they're on the unit.
All right. And maybe you can summarize best, what are they trained to do with regard to the application and maintenance of sequential compression devices?
They're trained to apply the sleeves and to manipulate them or to begin the pump.
Okay. How are they trained to apply the sleeves?
The training encompasses measuring of the sleeve itself and then wrapping the sleeve around the extremity.
Okay. Is there anything that has to do with sizing of the sleeves?
That's part of the measurement process,
Okay.
yes.
And describe for me how they go about measuring the sleeves.
The sleeves themselves are all measured. The manufacturer has a chart, and then the instructions are inside the package.
All right.